right mic and the right frame. Good morning. This is the Northwest Regional Health Authority, and today we are commemorating World Diabetes Day. Now, every other month you hear about some disease being brought up in the public. This is Diabetes Day, this is Epilepsy Day, this is, I don't know, COVID Day. We went through 2 years of that. Enough of that for the time being. However, today we want to focus on diabetes. What is diabetes? Do you have diabetes? Does any relatives in your family have this problem? What it is? We're going to address that today. What you're going to do about it, we're going to address that as well. And on top of all that, what kind of food are you going to eat for diabetes? We're not going to get into a religious bout here. We're just going to get what do you need for the treatment of diabetes. So, without further ado, we'd like to introduce you to Dr. Rita Padmore, who is a primary care physician of par excellence. She is going to give you, in simple terms, what is diabetes, what's it all about. So, stay tuned for Dr. Padmore.
Good morning. Thank you, Dr. Parkinson, for that kind introduction. And welcome. Welcome to our Facebook audience to this commemoration of World Diabetes Day, Access to Diabetes Care. Diabetes is a treatable condition. And the good news is that through education and increased awareness, many of us will be able to make healthier choices that can either delay the onset of diabetes and or prevent the complications of the condition. There are two main forms of diabetes. They are called type 1 and type 2, and a couple other minor ones. In all cases of diabetes, the fundamental problem is the same. The individual has too much sugar in his or her blood. Our human bodies use sugar in the form of glucose. This glucose is the main fuel of our bodies, and each of the cells of the body needs glucose in order for the cell to work well. When we eat food, when we put drink into our bodies, it is digested, and our body is able to take the glucose from the food and absorb it through the gut into our blood. And the glucose travels through the blood, reaching every single part of the body. The pancreas gland releases a hormone called insulin. When there is glucose in the blood, the pancreas is able to sense this and release insulin in an adequate amount to allow the glucose to move from the blood into the cells. In a healthy individual, there is a complementary match between the amount of glucose and the necessary insulin. In someone who has diabetes, this system does not work. For some, the pancreas gland is damaged early in life and it cannot produce insulin. These are the type 1 diabetics. They are insulin dependent at a very early age, quite often before the age of 30. For type 2 diabetics, most often the adult onset diabetic, the insulin that is produced is sometimes inadequate or is just not recognized by the cells. Thus, in both cases, the glucose level grows higher and higher in the blood. This is what is called hyperglycemia. Hyperglycemia results in a number of symptoms. Your body starts talking to you. You may be aware that you feel tired a lot of the time, and you may even find that you fall asleep at odd times during the day. You are thirsty and you can't satisfy your thirst, and you're making frequent visits to the toilet to pass urine. For some, they notice that there are cuts or wounds that take a really long time to heal, and for others, they get recurrent infections. For the ladies, a common experience might be vaginal thrush. These are some of the symptoms, some of the changes that happen in your body as hyperglycemia develops. If this is allowed to continue untreated, diabetes ultimately happens. And over many months and years, if ignored and undertreated, the complications develop. And these can affect your brain and show as a stroke, damage your heart, and someone might develop a heart attack. We also know diabetes does a lot of damage to our vision, our eyes, as well as can lead to kidney disease and kidney failure. Again, diabetes is treatable. If you pay attention to your body and you are seeing any of these symptoms develop, get tested. Testing and diagnosis of diabetes happens through a simple blood test, where just one drop of blood could reveal your diagnosis. Access and testing is available free of charge at all of our health centers. There are also a number of mobile units that visit and host health fairs at different venues across the community. The treatments for diabetes are also available through our public healthcare system. And some of these treatments, yes, do include medication, but diabetes is the ultimate lifestyle condition. And the great news is that with some simple adjustments to our behaviors, our activities, our choices of food and drink, our exercise habits, our sleep routine, and how we manage stress could make a significant impact in a positive way as to how our bodies can remain healthy and delay the onset of diabetes and avoid the complications. So as we continue to celebrate World Diabetes Day today, I encourage you to listen to the next few presenters as they talk about how these interventions and lifestyle changes can help benefit you and keep you and your family healthy. Thank you.
Thank you, Dr. Padma. So, diabetes is not a death sentence. We have weapons to fight this disease, and we can do it together. So come, get your blood tested, get your profiles done, let's see where you are. And now, further advice in how to tackle this disease. Nutrition is a very important aspect of our medical treatment and also our well-being. So, at this point in time, we're going to delve into the diabetic diet, but when I practice medicine, I don't like to use that word diabetic diet. It's not a specific diet, it's just a proper way of eating. So a diabetic diet is actually a proper way of eating. So let's go on to Ms. Cheryl Lewis, who is a dietitian by trade, by occupation, by certification. Of course, all these things matters in these days and age, because you must know exactly where you're getting the source of information. So let's go to Cheryl to see how we can manage diabetes with our diet.
Thank you, Dr. Parkinson, for that introduction, and you're absolutely correct. Basically, eating for diabetes is a healthy type of eating where we just place emphasis on the amount of sugar that you're consuming. So you would want to decrease the amount that you're having. So as I've mentioned, I am Cheryl Lewis, and I am one of the dietitians within the NWRHA, and I'm here to talk to you about healthy eating for persons with diabetes. So whether you are diabetic yourself or you know someone that's diabetic, it might be a spouse, a family member, a relative, I hope this information is useful to you. It may reinforce ideas that you would have already known, or if you're learning something new, I hope you'll be able to apply it to your daily life. So I'm here to talk about balanced, nutritious meals, meal spacing and timing, healthy cooking methods, as well as some healthy snack choices. So to begin, I do want to say that portion control is important. I will not be touching on it simply because it's something that you would need to be assessed with by your dietitian. So this will just be a general talk with respect to what are some healthy foods that you can have. So for reference, I will be referring to the Caribbean 6 food groups. So it looks like this diagram that I'm holding up here. You would be able to assess this just by a simple Google search. Right, so you just input Caribbean 6 food groups and this chart pops up. So first and foremost, I'll be tackling the staple food group, and within these groups, you want to choose items that are higher in fiber, because as the fiber is breaking down into your system, based on the foods that you eat, you get a slower release of the sugar. So everything that you're having should be more whole wheat, whole grain, multigrain type choices. So this would include breads. So whether the bread may be sliced bread, bakery type breads, sadas, the whole wheat version or the multigrain version would be what you should choose. Crackers, any whole wheat, multigrain crackers, those are what you can use. Brown rice, whole wheat pastas, provisions, they're excellent sources of fiber. Again, that fiber helps to slowly release the sugar in your system, and the sugar is what you basically are going to use the energy. Now, what also helps is porridges. So oats, sago, cream of wheat, cornmeal, all those are some healthy options that you can use. If you're doing any baking with flours, you can try to mix your flours. If you don't have access to whole wheat flours, maybe you can use your plain white flour, but adding like oats, wheat bran, wheat germ, flaxseed. Those are the choices that you should do. So really the takeaway from your staple food group should be that nothing is plain white. You always want to make sure that you incorporate that fiber with respect to whole wheat, multigrain type choices. The second group would be legumes, which is peas, beans, nuts, and seeds. So in this group here is where you get some protein from, especially for our vegan dietitian patients. This would be the main source of protein. So I'd recommend mainly dried, fresh, or frozen peas and beans. And of course, pumpkin seeds, sunflower seeds, those are things that you can use, as well as add them, as was mentioned before, to any breads that you'd be making. Where we have next foods from animals, so this is your major sources of protein. Of course, it's important for growth, repair, maintenance, or size. So the three lean types of meat we recommend would be chicken, fish, or turkey. When you have the chicken, try to aim for more the lean pieces. So this would be like your drumstick or your breast piece. And then you want to look at healthy seasoning methods. So try to stay as natural and as fresh as you can. So the fresh seasoning, so garlic, onion, side, pimento, so on. Right? You try to utilize those and also make use of dry herbs and spices. So if it's your paprika, your thyme, your oregano, they can be included as well. And healthy cooking methods is also a big thing within this healthy eating diet. So try to aim for more baking, steaming, grilling, roasting. And something that we tend to recommend a lot, because stewing is big in our culture, you would not be able to stew with sugar, because that would be an open invitation to spike your blood sugar levels. So you can stew, but there are healthy methods that you can use instead. So firstly, you can use the tomato paste method. So it's just a substitute for the sugar, and the meat actually comes out the same brown color, and the taste is just as good. Fufu, for those who are familiar with that can be used as an excellent method for stewing. Lime juice, any unsweetened juices, orange juice, unsweetened orange juice, unsweetened pineapple juice, or you can also just let the pot get really hot and throw in the meat, and it takes on a little color. So for diabetic patients, all hope is not lost with stewing is concerned. You just have to try to utilize the healthier method to prepare your meal. And when we're speaking of milks, try to use more like a low-fat milk, or you can even use soy milk or unsweetened almond milk. Again, for our vegan diabetics, those would be some lovely choices. Tuna, sardine, you can use those, utilize those in spring water. eggs, cheese that can be utilized as well. No more than once, twice for the week. So those would be your healthy food from animal choices, basically your main protein sources. And the next group we come to is very interesting because there are a lot of misconceptions concerning fruit within the diabetic community. So fruit can be used, they do contain natural sugars, but again, it's all about your portion, and this is what you and your dietitian can work with, so you can find out how much you are actually able to have. But we would not recommend you totally avoiding fruit in the diet. You try to incorporate it, but in moderation. And where the juices are concerned, the best type would be for you to use your freshly squeezed juice. And so if you have any Portugal's oranges in season, you squeeze it, add some water, and you're good to go there. Sugar is not necessary, as these fruits are naturally sweet and they contain their own natural sugars. So if they're not diabetics, you can have your fruit, but in small amounts. The fifth group we are coming now to, vegetables. So we do have both raw vegetables and yellow and other vegetables. So the raw vegetables, they're water based. You know, you can eat them, it doesn't spike the blood sugar levels. So the cucumbers, tomatoes, onions, sweet peppers, watercress. We do encourage you to try to have those at each meal. And then there's the yellow and other veg. So this would be your carrot, your bodi, chow mein type vegetables. They do give you a little bit more energy. So you're not having it freely or whenever you want as your dark green veg, but you would have portions allotted to it, and you try to incorporate both. So you don't want to do the raw veg but not your cooked veg, or the cooked veg and not the raw veg. Right? And lastly, we have the fats and the oils. So we try to stick for healthier types of fats, which tend to be more liquid or soft at room temperature. So avocado, when it was in season, that is a nice healthy fat. But again, where it goes wrong is when you have too much of it at once. So just be mindful of your portion control when it comes to the avocado. Your vegetable oils, your olive oils, those are fine to use. Your sausage margarines, those are okay. So even though they are the healthier versions of fat, you still need to use them in moderation because they are still fats at the end of the day. So this basically sums up the food groups. So all we did was look for ways where we could increase fiber, which would help to slowly release the sugar, so you have a gradual release better control of the blood sugar, and limit your fat, sugar, salt intake. So now I want to quickly touch on healthy snacks, because you do find healthy snacks within all the food groups. So from your staple choices, you can use your whole grain or your multigrain crackers, plain, or you can pair it with some natural peanut butter. You can use some bran or granola cereal. You can even do popcorn. So you can actually pop your own popcorn and use that as a healthy snack within your legume group. Your nuts, that is fine. You can even do a trail mix out of your seeds. So your pumpkin seeds, your sunflower seeds, you can add a little dried fruit, some loose granola. That is a healthy snack as well. From your food from animal, you can use a plain old cup of low-fat milk, or even low-fat yogurt. But with the yogurts, you have to be mindful of it because some of them would say low-fat, and then when you read labels, the reading is very important, you will see that it contains a lot of sugar. So just be wary and be cautious of that. But that can be used as a nice healthy snack, and you can do smoothies. So you can take your fresh fruit or frozen fruit, blend it with either water or your low-fat milk or your low-fat yogurt, turn that into a nice smoothie. Fruit, of course, the fresh fruit is fine. Vegetables, you can cut out some of it and have as a snack, a vegetable chow, some cucumber, some carrot. That would be fine. And from the fat and oil group, you can use some guacamole, which is like an avocado dip. So that can be paired with some whole wheat pizza, again some multigrain crackers, some whole wheat bread. So those are what I want you guys to start thinking about. How nutritious these meals can be and well balanced, and it would help with respect to controlling blood sugar. And remember, meal spacing and timing is important because you can choose healthy foods, you can prepare it using healthy methods, but then you're not eating on time or you're taking too long to eat. That will affect your blood sugar levels. So your aim should be to have your meals spaced 2.5 to 3 hours apart. So the structure should be your 3 main meals, your breakfast, lunch, dinner, with a mid-morning healthy snack, which would go in between your breakfast and your lunch, and a mid-afternoon healthy snack, which would go in between lunch and dinner. key. Just remember to space these meals 2.5 to 3 hours apart. So I hope these tips you use it in a positive way, and I hope that wherever you are, you will be able to access further diabetic information on this World Diabetes Day. And remember, for assistance with your portions, be sure to reach out to your dietitian, whether it's at your local health center or in the hospital setting. Thank you.
And there you have a proper way to eat food. Now, I'm not a cook. I don't prepare meals that much. I prepare manly type meals, meaning that, well, I won't go into that. But the thing I heard, you could still eat chicken, that's one. You could still have fruits, that's two. And above all, you can have popcorn, that's three. Now, don't make your diet out of these three things alone. This has shown, what our dietitian has shown, is that there are many choices of different types of food that are healthy to be used. Mix them in the right proportions. Diabetes is not a sentence to have a drab diet. You can have a lively, tasteful diet. There are many recipes on the net. Go look it up. In the times past, we used to go and buy cookbooks, but now what we do now, we go on the net and we search for proper diabetic diet. So go on the net, search for different types of dishes you can make that are diabetic as a book, diabetic proof. So now we learned a bit about the diet. There's another aspect of treating diabetes. In fact, there's another aspect of normal healthy living. And this now involves movement. You cannot sit down in one place. If you sit down in one place, you're like a tree, you plant roots, and there you will be for the rest of your life. You have to be active, you have to be moved. TT Moves is what the Ministry of Health is pushing for us to use. It's a good motto. Get up and start moving. So without further ado, I would like to introduce you to Amanda Reyes, who is a wellness coordinator. Wow, sounds like a conductor of an orchestra. How to conduct your wellness. So without further ado, I'd like to introduce you to Amanda Reyes.
Pleasant good morning all. Thank you for that introduction, Dr. Packardson. Okay, so today my name is Amanda Reyes, Wellness Coordinator of Northwest Regional Health Authority. And my role is to have exercise programs for persons with chronic disease, hypertension, diabetes within the health centers of the Fan One Health Center and Mova Health Center. So I'm here to just give some information pertaining to exercises that you can do at home. Even though you do have diabetes, it does not mean that you cannot be active. Actually, being active and movement actually help use up that sugars too much that is too high in the body. So using up that is a natural way. So some of the exercises that I recommend. So there is cardiovascular exercises, which are things like brisk walking, gardening, extra housework. Aqua aerobics is like aerobics in the water, in a pool of water. Hiking, any type of sport that you enjoy, things like tennis, football, anything that allows movement of the body, that raises the heart rate. So it will fall under cardiovascular exercise. Even things like Tai Chi, yoga, those things are nice. Stretching, just movement, that is considered cardiovascular exercise. Another form of exercise that should be added together is also called resistance or strength training. It's highly recommended because what it does, it helps to strengthen those muscles and bones, right? And it also uses those muscles. And when you use more muscles, it burns up more sugars within the body. So some of the exercises with the strength training will be things like you could use resistance bands. Alright, there are resistance bands on sale at sports stores. You can use those. There's also something called free weight, which is dumbbells. If you don't have dumbbells, you can use bottles of water. If you don't have that, you can use 2 tins of peas to do any kind of movements with the arms. Even the leg is just extra weight on the body, which helps to strengthen those muscles and bones. Also, you can use your own body weight exercises. So own body weight exercises are things like push-ups, pull-ups, sit-ups, tricep dips. So those are exercises that you can use using your own body weight. Also, if it is that you're not very mobile, you could do exercises sitting on a chair. Sitting on the chair using the same bottled water, dumbbell, resistance band. You can do hand movements, shoulder movements, bicep movements. So there's a variation of movements that you could use that will help to improve the body by strengthening it, also helping to lower your sugar levels naturally. Alright, so just reminder, so you're using a combination of the cardiovascular exercise. So for example, a workout routine could be you start walking on the spot, or you can make a few laps around the house, right? Or if you have stairs, you can go up and down the stairs a couple of times. That's to warm up the muscles in preparation for some exercise, which is the weight training or resistance training. Then you could go into using your buttocks. You could do some shoulder press, getting your hand extended over the head, doing different movements with your weight training. Or you could use your own body weight. You could do push-ups on the wall. If you want to challenge yourself some more, you could do some push-ups on the floor, right? The woman version is on your knees, which is the more modernized one. Alright, if you feel you're stronger, you could do the men one, full length push-ups. So those are just full own body weight exercises that you could use. And of course, you could always cool down by just marching on the spot and doing some stretches to allow your body to your heart rate to come back down and to be all relaxed. So we want to encourage you today to do some more movement, whatever it is. It could be whatever you enjoy. If you enjoy gardening, do gardening. Within the bucket that is a form of strength training. You're getting a hold, there's some strength getting in there. You're getting movement. The heart rate is raising. That's important. So movement is exceptionally important. Together with what my colleagues would have said, of course, your diet is important. So healthier eating go hand in hand with exercise. So there is hope. It is not the end of the world. There is hope for a person with diabetes to live a longer, healthier life by implementing these tremendous activities. Thank you for your time and have a wonderful afternoon.
Oh, welcome back. Welcome back. Yes, we heard about strength training using water bottles. This is ridiculous. This is too small a weight. You need something a little bigger than this. Depends on your size. So use a water bottle that has some resistance. This is barely any resistance for me. I'm not a big muscle person, but this is still very, very resistant. Be innovative. If you can't afford a gym, which most of us can't, exercise at home. Find something you like to do. First of all, you like walking? Oh, hiking is fantastic. Playing tennis, football, running, anything at all. Find something that gets you moving. Gardening is one thing too. That's a lot of work. But find something you like to do and stick with it. Try to do it almost every other day. But important thing with exercise, you must get some rest. Don't say I'm going to train for the Olympics. That's for another day. Right now, we want you to train to live. So every other day, do some exercise. Rest one day, do something the other day. Something a little bit more. And try to press against the envelope. Just reach out further. Every other day, try to move a little bit more. Extend yourself. When you do this, you'll find the normal things in life will become much more easier. Getting up, cooking, moving around, sweeping the house, vacuuming, whatever it is you have to do, going to the grocery, you'll find it's a lot easier. And, I mentioned grocery. Those of us who go to the grocery and have to find a parking spot right up next to the entrance of the grocery, for crying out loud. Those are for handicapped people. I don't think you are handicapped. Park your car in a distance away and briskly walk like somebody in good health to the door and come back out with the groceries looking good. Alright? That is exercise as well. So, let's go in and look back at what we just learned today. We learned about what diabetes is. We have identified the enemy. We know who you are, diabetes, we know how to take care of you. We're going to see the doctors, assess your diabetes, what you're taking. Do you need tablets? Do you need diet alone? Do you need insulin? Whatever. Let your doctor assess you. Then, what's your diet? Go on in that, find other wonderful recipes, learn to eat with those recipes, enjoy life. This is not a death sentence. This is a new lease on life. And keep moving. No matter what you do, get out there, exercise, strength training, muscle training, whatever it is, get out there and exercise. This is the Northwest Regional Health Authority. I'm Dr. Anthony Parkinson, I'm the Director of Health at this institution, and we want to welcome you to come see our physicians. Come to the Primary Health Center, see our physicians. They are willing to look after you in a friendly, in a decent manner. They respect you. They respect who you are and what you're going through. Listen to them. They will guide you. They have had extensive training. Doctors, nurses, all the other ancillary staff, they have extensive training and they are geared to assist you. So this is the Northwest Regional Health Authority. Have a wonderful day. Those of you who came on and logged on, thank you for coming. Share this with other people so that they too may understand what diabetes is an enemy, but we will conquer it. So long, blessings to you.